So there's lots of places where people can go for advice. So the first thing is the person who normally looks after you, so usually your GP or practice nurse is the first port of call. If you're looked after in the diabetes centre at the Norfolk and Norwich or your normal diabetes team, then you can contact your diabetes team. Most people would have a helpline. Most people would have, for example, here at the Norfolk and Norwich we have a telephone helpline which the nurses will answer and man, and they'll be able to get back to you. We'd have the drop-in service between 9 and 10 for many people who are under the care of the diabetes centre.
We do run a group ACT session, so that is acceptance and commitment therapy over a 6-week course with other people in a similar situation. Sometimes that can be really beneficial purely for the fact that you're meeting other people in a very similar situation, and that sense of normalising the difficult thoughts and feelings that come up commonly with diabetes. Throughout that process, we work on acceptance of diagnosis, and we help people to develop strategies to cope with the difficult thoughts and feelings that come along with diabetes sometimes. And generally speaking, we've seen really positive results from that group.
There's one other service that people might find helpful in that about 10 years ago we set up a patient supporters group or a peer advisors group, which are people who have diabetes themselves. And what we found is that when patients are in a consulting room with a doctor, it's actually a very stressful experience. They don't always talk about what they really want to talk about.
Yes, as healthcare professionals, we can obviously advise patients, but we can't really truly understand what it's like to live with diabetes for 24 hours a day, 7 days a week. So therefore it's really helpful for patients to be able to speak to somebody who's actually living with diabetes and who's got life experience with diabetes.
Because a lot of people, when they're first diagnosed, they'll see the doctor or the nurse, whatever like that. They'll then go away from their appointment and they may have questions to ask. They have no experience of living with diabetes. So what we've done, we formed a group of people, both with type 1 diabetes and type 2 diabetes. We have a free phone line that people can ring up and just have a chat about anything they want, really. That's usually everyday stuff, but if we do find somebody who's got a little bit of a problem, we've got a referral system where we can get them referred back into the specialist nurses or back to the GP. People can ring up if they're for instance worried about if they want to speak to someone who's had a diabetic pregnancy. If they're converting from tablets to insulin, they can speak to someone there. We have all age ranges in the group, and it's quite nice to be able to pair someone up, and people usually find it quite helpful.
So Diabetes UK is the main charity for people with diabetes, but they're also the main information source. Most people would have heard of Diabetes UK, and you can either Google them or go to their website diabetes.org.uk, and they have an enormous amount of information on their website. And if you don't have access to the internet, then you can go to the library, and libraries have free internet access for most people, and you can just ask them to help you. And there's lots of information. You can go to the library. There are lots of books available.
They also do road shows, usually locally. They'll use for instance, in Norfolk, there'll probably 1 or 2, maybe even 3 different places around where people can go and access information. Or people without diabetes can be checked to see if possibility that they might develop diabetes, because this is the big thing, is trying to catch people early to make sure that they can get the intervention treatment that they need as soon as possible, and that improves the long-term outcome of living with diabetes. So if you're watching this and you haven't got diabetes, you have got it in the family, so it's worth possibly getting it checked out yourself, just to make sure that you're, make sure you're okay.
Diabetes UK are marvellous. They have lots of resources, they have helplines, videos. So whenever a patient comes to see me, I always suggest that they go onto the Diabetes UK website or call them for information, because they offer information over a wide range of aspects, and they also offer in various languages as well, which is quite important.
It's very important now in the NHS and a lot of other bodies to get the input from the man in the street. We can represent what it actually feels like to live with diabetes and what we think is needed for the best sort of outcome for that person, really. And so we do get involved and try and represent the patient's point of view in quite a lot of areas. We get involved in educational programs for the health professionals. We talk to nurse practitioner groups, we talk to GP surgery groups, generally to sort of give information out for one thing, also to represent the patient's perspective